Today we're focusing on conditions of the inner ear. Even though this part of the ear is small, problems here can seriously affect balance, hearing, and overall quality of life. Disorders of balance. Patients often report feeling dizzy, but it's important to clarify what they mean. Dizziness is a broad term, often used to describe lightheadedness. Vertigo is more specific. It's the illusion of motion, often described as spinning of the self or the environment. Ataxia refers to a lack of muscular coordination, commonly seen with vestibular disease. Syncope or fainting is not vertigo. It usually indicates a cardiovascular cause. Nystagmus is involuntary rhythmic eye movement. It can occur normally, such as when watching out the window of a moving car, but pathologic nystagmus signals vestibular dysfunction. Motion sickness. Motion sickness happens when the inner ear and the eyes send conflicting signals to the brain. Common triggers include traveling by boat, car, or plane, or even using virtual reality. Symptoms: sweating, pallor, nausea, and vomiting. These can persist even after motion stops. Management. Over-the-counter antihistamines like dimenhydrinate or meclizine reduce vestibular conduction. Scopolamine patches are also effective, but must be applied several hours before travel and changed every 3 days. Side effects include dry mouth and drowsiness. Patients should avoid driving or operating machinery while using these medications. Benign paroxysmal positional vertigo, BPPV. BPPV is one of the most common vestibular disorders. It causes sudden, brief episodes of vertigo when the head position changes relative to gravity. It's due to dislodged calcium carbonate crystals, otoconia, in the semicircular canals, often triggered by trauma or infection. Symptoms: sudden vertigo with head movement, often with nausea and vomiting. Hearing is usually unaffected. Management: bed rest during acute episodes. Canalith repositioning procedure, a sequence of head and body movements that relocates the crystals. Safe, quick, and highly effective. Short-term use of meclizine for symptom relief. Vestibular rehabilitation exercises for persistent cases. Tinnitus. Tinnitus affects about 25 million adults in the U.S., described as ringing, buzzing, hissing, or roaring in one or both ears. Causes may include cardiovascular or thyroid disease, vitamin B12 deficiency, neurologic conditions such as multiple sclerosis or head injury, Meniere's disease or acoustic neuroma, ototoxic drugs, evaluation physical exam, audiogram, tympanogram. Management. Some cases are irreversible. Education and counseling are key. Coping strategies, masking devices, sound therapy, and cognitive behavioral therapy. Acoustic neuroma, also called vestibular schwannoma, this is a benign tumor of cranial nerve 8. Usually arises in the internal auditory canal and may extend to the brainstem. Most cases are unilateral, but bilateral tumors can occur in neurofibromatosis type 2. Occurs equally in men and women, most often in middle age. Clinical signs: unilateral tinnitus, progressive hearing loss, sometimes vertigo or imbalance. Diagnosis: MRI with gadolinium contrast is the gold standard. Management options: 1. Observation, for small tumors or older patients. 2. Surgical removal, preferred for younger or symptomatic patients. Goal is tumor removal with facial nerve preservation. 3. Radiation therapy, alternative for non-surgical candidates. Complications: facial nerve paralysis, cerebrospinal fluid leakage, meningitis, cerebral edema. Death is rare. Summary: balance disorders include dizziness, vertigo, and nystagmus. Precise definitions matter for diagnosis. Motion sickness and BPPV are common vestibular problems with clear treatments. Tinnitus can be benign but often signals systemic or otologic disease. Acoustic neuroma is a rare benign tumor that requires careful evaluation and, in many cases, surgery.